So we're going to go through a supinated foot. There is a couple of reasons linked to why this can happen in a patient, and there's certain things that we should be looking out for. So first of all, a generic supinated foot without any other biomechanical issues can be coming from the perineals. So these are muscles that run down the outside of your lower leg, so the lateral side, and they insert into the outside of your foot. And if these are long and weak, they're not going to have the control of the foot that is needed for a normal stance during your walking cycle, ending up with a weaker lateral side, so outside of the foot, leading to a supinated foot. Also, we could have other biomechanical issues. So starting from the heel, we could have an inverted calcaneus. So the calcaneus is your heel bone, and inversion basically means that it's sort of facing inwards rather than outwards. Okay, so it's sort of lay onto its side. So because of this then changes how the midfoot moves. Think of it a bit like a seesaw. Whatever the heel does, the midfoot does the opposite. So if the calcaneus, the heel bone, is inverting, so coming inwards, the midfoot is then have to go outwards to counteract the movement, causing a forefoot midfoot varus, where the midfoot is now turned outwards, so the inside of the foot lifts away from the floor, and we're putting more pressure on the outside of the foot into that supinated position. Another issue that can be causing this is your first ray. So this is your big toe that can be an issue. So if this bone, your first ray, is in a dorsiflexed position, you're going to reduce the range of motion coming from that big toe, which is lifting up the toe, probably coming most likely from the extensor muscles of the hallux, causing that forefoot varus once again pushing you into that supination position of the entire foot. Also, what it's key to look at with your perineals is if they're not engaging at the correct time, then you're not getting the locking process of the lateral ankle, so the outside of the foot. So once you go from heel strike into your lateral stance, the foot and ankle should begin to lock to allow you to come over into that pronation of the midfoot and ready for your toe off. However, if this isn't working, you're going to end up again with that forefoot varus lifting through there. So how do we fix this? First of all, test the perineals. Are they working? Are they strong? Are they long and stretched and weak? Or are they overactive and they're not getting the full contraction that they need? So you're either going to go into perineal strengthening or perineal stretching. With an orthotic, you're going to look at each stage of the foot again. So beginning with your heel. If you've got that inverted calcaneus, then we're going to create a heel cup in your orthotic to create that neutral for the heel. So we're going to push it back into a neutral position. Looking further down, are we going to need some sort of support under the arch? If there's a limited movement at the big toe, are we going to need some sort of cutout for that hallux, for that first ray, to increase the dorsiflexion there?